Jong Yi, a distinguished author, brings us the story of a nurse named Ginger Kim, who experiences bigotry, racism, and discrimination in her workplace due to her South Korean background. Jong proves in her book, Fighting to Breathe, the systematic racism that exists within healthcare industry. Thank you for joining us today, Jong.
No problem.
First of all, I would like to acknowledge the importance of this topic during this sensitive time, where due to social media, cell phone cameras, we are witnessing more racism being captured. And thank you for using your platform as an author to bring more awareness to this topic.
Yeah, I think it's very important. And it took me a long time to talk about this because obviously a lot of different reasons. When COVID hit, it really encouraged me to just go with your guts and talk about it. Mm-hmm. And I believe a lot of people need to stand up and talk about it. I know there are a lot of demonstrations and some particular people, only specific type of people speaks up. But if we need to make changes, the change has to come from all different directions and all different level. So it's very, I believe personally, it's important to talk about that same issue, racism, from all different level.
Yeah, that's you explained it very well, and hopefully the changes, I'm seeing more changes coming, and people like yourselves are writing about it, bringing awareness to our people. And my first question is, let's start with COVID, because that's just, it's been very challenging for all of us. So when COVID hit, it impacts worldwide, it impacts everybody. But a disturbing trend evident is in US that people of color are experiencing more severe illnesses and death due to COVID-19 than white population. Why do you think that is?
I think it's not surprising. I think it's because they have underlying health conditions and dense living conditions and employment in the service industry as an essential worker, or limited access to the healthcare. Mm-hmm. And only the COVID, after the hit by the COVID, it kind of highlighted the issue.
Mm-hmm. Yeah, that's a very good point, because it's not only the healthcare industry that you experience racism, or people of color are experiencing hardship, but as you mentioned, in their workplace, maybe due to their employment, their education, the community support, they're having harder time to cope with that.
Absolutely.
So, yeah, and that's exactly what it is. So I want to talk about your book, Fighting to Breathe. You explain the racism Ginger Kim and her colleagues, who were also nurses of color or a minority group, endured racism and discrimination in hospitals and places that they were working. But the people who were in charge, or hospital staff or management, they did not do enough. How can we bring, that's very unfortunate when you talk about it, but it's the reality that exists in the US and most places in the world right now. How can we bring more awareness and education about race in healthcare industry while taking those who are responsible accountable?
As I mentioned earlier, the change has to come from all different levels. And I believe a lot of people will agree. You can't change things overnight. It'll come slowly and gradually. But if we don't try it, nothing's gonna happen. Everybody has to take everybody has to pitch in. And also it has to, not just individual level, but I believe it has to come from federal level, local level, and group level. It has to come from all different direction. People has to put effort to it. And change doesn't always mean easy or pleasant, but it's not always bad, you know? It could be very, very positive thing. Mm-hmm. As we're all human beings.
I love the phrase you said, change is not easy, but sometimes it could be for the better. That is very powerful. And we are seeing the changes slowly. I think the media helped that. Not necessarily the media that is being around for a long time. I'm talking about the individual media, the citizens media, we call them, who everybody has a cell phone these days and capture the moments, and they can bring awareness to the society. So I think the technology in that way help us. What makes you write the book? I mean, did you know Ginger firsthand, or was it a personal experience that you made a story of?
After I immigrated to this country, I felt it. But at the beginning, I think a lot of people will agree. You know, when you're new to this country, you want to be good, you know, and you want to work hard, and you do your very best. And sometimes it's because you want to be good citizen, you know, part of this you know, amazing country. Also, you want to prove yourself. Okay, if I do better, maybe they'll treat me equal. You know what I mean? But that wasn't the case. And with my career, it was getting way too much. And I think all those stress and all those unfairness and discrimination pushed me really to have a courage to write about it and talk about it. I know that a lot of people, a lot of nurses in color will agree with me, with my book, what's happening in the book, but I think they're afraid to talk about it.
Why do you think is that?
Oh, because, you know, sometimes it could be a cultural thing. Because a lot of, for example, since I'm Asian, I'll talk about Asian culture. We were taught to be not speak up, not voice, don't raise your voice, just keep your head down, don't talk about it. And you need to be humble. That's really, really outdated. We need to wake up. It's important for you to keep your own culture within yourself, but it is very important for you to understand your surroundings, because you're not living in your home country. You're living in this westernized country. You need to open mind to it. You need to able to learn about this culture and understand where you are and who you work with and where you know, what type of difficulty that you're facing. You need to speak up. You need to talk about it. And I think it's very important having your voice, because having your own voice is not always negative. It's not always against your culture. You need to talk about it. As sometimes when you don't talk about it, there's no way other people will understand what you're thinking, right?
Mm-hmm. The courage to speak up. That's what we need to encourage.
We need to be encouraged to talk about things and discuss. And I think people needs to understand the nurses in color. Since I'm nurse, I'm going to talk about nurse and in color. I think a lot of times they're afraid because of the retaliation. Also, nurses are not just cultural thing, but we were taught to be caring, helpful, be positive. You know what I mean? I think a lot of things kind of combine with why we are not willing to talk about it, or it's just really hard for them to talk about things.
Oh, that's you brought up the very relatable points, because I think in every industry we've learned to be positive, right? We have to be positive, but I think sometimes it gets too much. You just need to also take back and say,
right.
Oh, there are some problems.
Mm-hmm. How can we make improvement if we don't talk about it? You need to talk about it.
Exactly. Now, I wanted to go back to the book because it's very interesting. When I was kind of reading some of the part of it, and unfortunately, Ginger, the nurse in your book, she, in the beginning of the COVID, due to lack of PPE and equipment and protective equipment, she gets COVID and she gets very sick. But as a patient, even though she was a nurse and helping to combat this disease, as a patient, she was also experiencing discrimination and racism, which is very unfortunate. So similar to her, many patients of color, whether due to their color of the skin, accent, not understanding